Atopic dermatitis has one of the highest burden of disease for the patients who have it. It's not just the visible lesion, it's the itch, it's the sleeplessness, and we as dermatologists, we have to take care of all these aspects and bring new therapies to work.
The most important symptom of atopic dermatitis is an unbearable itch. And you cannot forget itch. Itch is an alarm signal, you cannot suppress it. So these patients have a real hard suffering from itching that can be throughout the whole day. It keeps people from sleeping. And we all know what it means if you haven't slept 1 or 2 nights badly. But there are severe atopic dermatitis patients who almost never can sleep well.
I think there's so many issues. Of course, the eczema, the itch and the pain in the skin, how the skin looks. Patients have social problems because they think they look different. They are stigmatized by their disease. And also there are so many activities they find difficult doing sport when you sweat and then there's pain in the skin. And also the attention because you sometimes have sleep disorders. You itch in the night, so it's difficult to sleep, and then you're very tired in the daytime.
Bullying and social isolation create an extra burden on the patient, especially young children and adolescents.
Scratching disturbs the ability to learn, the ability to sleep, the ability to concentrate, and has an impact in family life, in intimate life, in professional life. And it impairs self-confidence and the ability to be happy and to live a normal life.
The disease burden in atopic dermatitis is very broad, and it leads also to anxiety and depression. Atopic dermatitis has different ways of expressing itself. There are a variety of trigger factors, there are a variety of responses to treatments, and the approach to the disease in Europe is still quite heterogeneous.
We also have challenges in Europe because we don't have the same kind of resources in every country. Some countries are more privileged regarding economics and have access to very advanced treatment, and some countries do not have the same advantages. So even though we want to have the same guidelines, we have different issues in parts of Europe, which makes it sometimes difficult to get access for the patients to the same kind of treatment.
We have learned over the last couple of years the best practice standards, and it would be of great benefit for the patients if we really apply similar standards in diagnosis and treatment.
We need to inform about the burden of the disease. We need to work hand in hand with patients and with healthcare professionals to improve the level of care, because now the patients can get the treatment and the care they deserve. Well, how can we improve diagnosis rate? First of all, we need to make accessible to patients and families simple tools to improve diagnosis. We have diagnostic criteria which have been validated, such as the Williams criteria. We need also to improve training of doctors, general practitioners, but also specialists to recognize atopic dermatitis and to be aware of the burden it has on patients.
We can elevate the diagnosis rates of atopic dermatitis by improving disease-specific knowledge among society as well as healthcare deliverers, promoting doctor-patient communication during the clinical consultation, and implementing better practices for referral to specialists.
Every atopic dermatitis is different because there are very, very many genes affected in a patient, and it's never the same. Every patient is different, and everybody is living in a slightly different environment.
Personalized treatments move healthcare away from an approach that looks at all people affected by a condition as one group, and it should be focusing more directly on the individual person, their diagnosis, and how to care for them based on their lifestyle and circumstances.
Atopic dermatitis is a chronic disease. The ultimate goal would be that the patients get control and take control of their disease management.
We have to educate our patients and facilitate them with living with the disease, deliver coping strategies, tell them how important topical, emollient, basic treatment is, and what should be done in addition in a good shared decision making with their dermatologist.
My vision is that in the future, the choice will be presented by doctor or nurses, and the patients will be able to make his or her own choice based on what he or she wants to achieve.